Wednesday, the 15th of November, 2023. And guess what? We will never see that day again. That is it. That's the truth. We will never see that day again. Good morning, good morning, good morning to you. It is a pleasure sitting here in the studios of QFM after 5 weeks of, maybe should I say, vacation break? 5 weeks of vacation break. I can tell you that I am well rested. The voice is rested, the brain is rested, the body is rested, and I'm all energized until the end of the year. As we know, Christmas season is upon us. I was just actually in Trinidad and I came back home on Sunday, and Trinidad is in full Christmas vibes already. Every mall, every place is decorated in Christmas, Christmas parang all over the place. And so this morning I got up and I started playing my Christmas too. I started playing my oldie goldie Jim Reeves Christmas, and I started feeling the vibes of Christmas even in my home. So, good morning, good morning, good morning. I did miss you, but I know that you were in safe hands. I think I may have listened to Health Vibes maybe twice within the 5 weeks, and I must say that, yeah, we represented quite well. I think I can retire, truly.
I don't think the listeners will agree.
I don't think they'll agree.
I don't think they'll agree.
Man, Vivian, if you see Trudy this morning, I must say I was wondering if a Sasha rep was here in Dominica that I didn't know about. Trudy, your face looks amazingly beautiful this morning.
Thank you, Carlton. Good morning. Good morning to the listeners of Q95 Radio. Of course, it has been a long time without you, and I feel like I was.
Yeah, go Paul.
I had something, Carlton. I don't want to say that word, but but I was like, when is Carlton coming back now? I keep saying he'll be back on next week. Then I hear, okay, not next week, the next week. So I was counting down the weeks to your return, and I know the listeners will as well. They love to hear you on the show, and they sometimes they hesitant to call when it's just in fun. They want to call, but their boy Carlton is not on, so they're hesitating a little. But good morning, good morning. We did have over the past 5 weeks, we did have our faithful listeners still following Health Vibes and still making some wonderful contributions. But Carlton, it is definitely a pleasure for you to be back on the airwaves and for us to continue with our vibes on a Wednesday morning.
Yes. I must say that I did miss the radio, maybe to the latter end of my holiday. But honestly, I was happy to get that break. My brain needed the break. My brain really needed the break. And it's Christmas time, it's giveaway time. Around December, it's kind of free up on Health Vibes. We don't take nothing too serious.
Right.
And we kind of give away things. And so that time is coming where everybody's going to be trying to listen to Health Vibes to see what they're going to
what
win.
they can win, what they can win.
and so we're happy about that. But this morning we are expecting Dr. Jolly because yesterday was World Diabetes Day, Trudy. I am not too sure if you would have seen the health fair that took place in Portsmouth.
Yes, I tuned into the live stream. I saw you in your element. I saw the cardio jam as well.
Yes, I participated.
Yeah, the cardio jam looked fun. Looked like people had a good time.
Yes.
And of course, I noticed you all collaborated with the American Canadian Medical University down there in Portsmouth. And there were several personnel from that university also present at Jolly's Portsmouth. So I looked online and I saw it looked like it was a success.
It was a success, and we were really happy. We began just about 3 o'clock in the afternoon, and we saw about 50 people.
Okay,
it was a really good initiative. I know that the university were very impressed, and they're saying already when is the next collaboration. And so we're really happy. We were really happy. We had Dr. Centilier with us. He
Okay.
came by. He's heading the CNC. He's the local coordinator for the
Okay.
CNC, chronic non-communicable diseases in
Diseases.
the
Okay.
Ministry of Health. We had Mrs. Toussaint from Health Promotion Unit. We had the Portsmouth Health team.
Mhm.
So it was a really good vibes. It was
Okay.
really, really good down there. And I think everybody really enjoyed it.
Okay.
Enjoyed it. Diabetes remains a very serious concern to us in Dominica, the world by extension. The last statistic that I read, it indicated that to every 10 adult person in Dominica, one is diabetic.
1 in 10.
1 in 10.
Okay. That even
And that was
seems
2017.
yeah.
So in 2023 now, so you can imagine most likely would have seen a spike. Yes, and the risk factors are still very alarming. Obesity, um, our sedimentary lifestyle, the abuse of alcohol, smoking. We know that the family history as well,
genetics.
genetics is also a factor. And one of the main concern regarding diabetes is the complications. We know that to every, the statistics are showing to every person, that to every one person that's an amputee in Dominica, based on the statistics, 9 out of 10 were caused by diabetes versus an accident or some other trauma.
And that's why when we talk about diabetes in particular, well, I like to talk about it in relation to prevention, but also in relation to management, because a lot of these complications that you may refer to would be caused by uncontrolled or improperly managed diabetes. So sometimes people do have the disease and they are able to manage the disease well enough that they avoid some of the more devastating complications, the loss of limbs, or amputations, or the loss of their sight, the neuropathy, the nerve pain. Sometimes people do, manage and avoid some of those complications, but others, seem to be unable to do so, and they suffer greatly. So diabetes comes with a big burden as it relates to morbidity, sickness. So imagine, being an amputee and losing your ability to therefore, provide for yourself maybe, or manage your own home, and therefore becoming reliant on others, and that now poses a burden to the family and the community by extension. So it's a very wide set of things to consider when we talk about diabetes. Other chronic non-communicable diseases or non-communicable diseases as well, but diabetes is so prevalent in our population. It's worthy of a discussion.
And the thing is that diabetes, because it's an endocrine system disease, it affects so many areas of the body and organs of the body. A lot of times people don't see the correlation with diabetes and the cardiovascular system. And hence the reason why you end up having neuropathy, and even having, there is a strong link with diabetes and hypolipidemia, high cholesterol. And the new studies is showing that if you have diabetes, you will more than likely end up having a high cholesterol issue at some point. And if you have high cholesterol as a medical condition, you will subsequently, or you may subsequently develop diabetes. And that is something that is quite, peculiar, because for me, I remember in 2020 when I did my screening, and I did mention to you that my number, when I did my HbA1c, it had showed me in pre-diabetic stage. And I was quite, I was very distraught at that point. But at the same time too, my cholesterol, my triglycerides was borderline high. See, my triglycerides was borderline high, and my total cholesterol was borderline high as well. So you really see truly the evidence of the link with high cholesterol and diabetes. I see we have a caller
Yeah,
already.
somebody has
This
been trying
caller-
to call us.
call in.
Hey, good morning to you, Carlton. Welcome back.
I mentioned your name with us, sir.
Imagine I just ran up this step and I heard your voice. Let me just welcome you back.
Thank
that
you.
Five weeks just look like 3 weeks, to me.
Boy, I know time runs,
Yeah, it
flies away.
Tuesday morning to you.
Good morning. You missed your shout out first thing this morning.
Yeah, because I was outside. And I just run up this step. I just maybe make an intervention because I'm going to be occupied for all air.
Yes.
And you have a good one.
Thank you so much.
Bye-bye.
Thank you.
Welcome back.
Thank you. Yes. And yeah, we want to really thank you, Mervyn, for the greetings, and I appreciate that. Our guest is in. Dr. Jolie is in. And yesterday, as we did say, was World Diabetes Day, and today we are going to be talking about diabetes and the concerns relating to the disease, even some of the misconceptions that we have, some of the issues that people face, even in terms of access to maybe even specific specialists on island. Sometimes we have to, go elsewhere to access that. And this year the focus is on access to healthcare, meaning, do we have adequate nutritionists on island? Do we have a podiatrist on island? Do we have adequate diabetes specialists? Do we have people who are fitness instructors, but at the same time too, they are trained on diabetes care so that they can tailor their programs for diabetic patients and people. So all of that, when we talk about the access, we including all of that, the pharmacies, the role of the pharmacists in the management, adherence of medications that would be prescribed to diabetics, the cost of medicines, and even other items, including foods that diabetics should be consuming. So all of that. Are there clubs that are available for diabetics? So anybody that's, you want to be in a part of a club, you want to a space where maybe there is some
Support
exercise,
group,
or there is a group, there's an empowerment group, or some type of advocacy, do we have that? And so we're going to be discussing all of that this morning. What we're going to do, we're going to take a short break, and then we will be right back.
Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. And that is JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun with your daughter or with your son. We cater to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun. Bring Papa and Mama along. We cater to everyone. What a happy place. Oh, what a happy place. Purchase 6 or more of any item and you automatically qualify for a discount. Check us out at the Mega Store in Funkole, where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
Introducing Jolly's Pharmacy, brand new website, www.jollies.dm. It's your time to jump the line. Shop now at jollies.dm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.dm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.dm. Jollies Pharmacy, leading the way in healthcare.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
All right, so we're back with you this morning. As I said, we're talking about diabetes, as yesterday the world celebrated World Diabetes Day. Now, I wanted to actually begin the discussion with an excerpt that was published in the year 2016 by the Dominican News Online. That was June 22nd, 2016. And the headlines read, "Statistics show worrying trends in diabetes, obesity in Dominica." Diabetes to be a major problem in today's society and among the leading causes of death in Dominica, statistics from the World Health Organization has shown. Additionally, Pan American Health Organization, PAHO, representative for Barbados and the Eastern Caribbean, Dr. Godfrey Ureb, said obesity in adults have reached epidemic proportion on the island. Speaking at the Dominica Diabetes Association annual general meeting held at the Public Service Union building on Wednesday, that is at the time, he said World Health Organization statistics published in April shows that 1 in 10 adults have diabetes in Dominica. He said over the last 30 years, the number of persons diagnosed with diabetes has increased. This in itself is a worrying statistic, but even more worrying is the trend, he noted. Over the last 30 years, those diagnosed with diabetes in Dominica have risen from just over 5%, so 5 for every 100 in 1980, to almost 15%. That is, so 15 to every 100 people in 2014. He said the number of female diabetics has tripled in one generation, and the data for men is equally grim. And so he said obesity in adults have reached epidemic proportions and is manifested itself in the number of cases of diagnosed diabetes and persons with high blood pressure, as seen as problems associated with these two silent killers. The problem gets worse when we see what is happening to our younger generation, the generation of the future, the ones who should be carrying Dominica to the next decade. And I will stop there. Dr. Charlie, what is your take on this old news item that was all the way in 2016? We in 2023. Have you seen the trend worsen, or have you seen it merely almost similar to those statistics?
And Dr. Jolly, good morning to you.
Good morning. Good morning.
Carlton threw a question, but we haven't told you good morning.
Good morning. That's all right. That's all right. We had a good clinic yesterday. So,
I
yes.
saw you all.
Yes. So yes, unfortunately, the trend has worsened. I think there's increasing number of people who are being diagnosed with diabetes. Unfortunately, seeing increasing numbers in the youth as well. And so that is very concerning, because it means that in the future, next 10 to 20 years, you will see more. Well, if we don't get it under control, we'll see more diabetes complications. And so it is worsening, as the article. And a matter of fact, there was in 2018, there was a note that was written by Dr. Carissa Etienne. and that was written 10 years prior. And what Dr. Etienne wrote 10 years prior was the same, if not worse. And
Wow.
so unfortunately, things have not improved. But I think there are great strides are being made in terms of screening. I think we're becoming a little clearer in terms of the diagnosis. So more people are getting the diagnosis of type 2 diabetes, and consequently, they are able to make the necessary lifestyle changes to either reverse uh, or properly treat the condition. I think there more than ever there is more information concerning food, appropriate diet. I see more people engaged in physical activity, whether it be walking or playing sports. I think Jolly's Pharmacy has done a good job with the cardio jams. Yes, it tends to be aerobic, light exercise for me, light exercise. But I yesterday there was a cardio jam at Portsmouth. A matter of fact, from what I understand, people requested it, so they seem to enjoy.
Yes.
Folks seem to enjoy the cardio jam, and so there seems to be growing enthusiasm for group physical activities, which is a good thing. It's a good thing.
In terms of people's perception and their own knowledge on diabetes, when you would have, let's say you diagnose someone with diabetes today, and you have to break that news to them, what is the general perception or some of the questions that they would normally ask you?
There's more acceptance now. There's more acceptance. It's not so much anymore of a taboo. So there is more an acceptance. Probably before people say, well, is a trace or
A
is
touch
it
of
or
sugar?
a touch or borderline? There's an acceptance. There's also a great willingness to lifestyle change. A matter of fact, I have seen patients who have gotten their diabetes under control or reverse the diagnosis of diabetes with just lifestyle changes and weight loss. And so I believe there is greater acceptance, but also greater willingness to make the necessary changes. There's increased acceptance of insulin as a treatment for diabetes. People are willing to do what it takes in order to take care of this condition. I do remember there was a young lady she was in her 30s, so she was fairly young, and I had to break it to her that she had diabetes, and she started crying. I haven't seen that in a while, thank God, but and also even in cases we have seen under the age of 20, where you have under the age of 20 you have that diagnosis. It's not it's not as scary, I think, as it used to be. And so I think these discussions that we're having on Q95, the discussions that are happening in the community, the testing that's happening at the Jolly's National Clinics, whether it's in the community or whether it's in your workplace, the corporate, the business places that do these clinics as well, there is more of an acceptance and a willingness to do what it takes to manage diabetes.
Dr. Jolly, I had a question. When you speak of, people reversing or managing the disease with just lifestyle changes, is there an aspect of when someone gets that diagnosis that leads to that capability? Meaning, if someone is diagnosed after they've been, diabetic for a long time, as opposed to someone who is diagnosed,
For a short period of
right?
time.
Is there a difference in what you can do based on when you are diagnosed?
I think so. One of the truths is that when someone is diagnosed with diabetes, especially type 2 diabetes, we don't know exactly when they developed it, because you could walk around with type 2 diabetes for quite some time and not know it. But what I find is that those who I find those who are either younger, and if it's a short period of time, they're able to reverse it.
Okay.
And also if they know that there's something that precipitated the event. So unfortunately, we've had cases. You see people who maybe Christmas time, or folks who eat a lot of candy. They know what they did,
Fruitcake.
and they and so if they're able to make those, or you find that if you drink a lot of soda too, that raises the blood sugar, and that could lead to a diagnosis. Then if people are willing to make those changes and to do so, then they're able to reverse it.
But do you find that people are more, the mere fact that people are more accepting to the diagnosis and the medical condition, have you seen that equated to better lifestyle modifications? Or people are still struggling to make the adjustments, necessary healthy adjustments that would credit,
Yes.
a reduction in the HbA1c results, a reduction, a better number in the glucose levels?
I think Dominicans not only are willing, but we have the food available. We have the good food available. So I find that in the Caribbean in general, we're not big tablet people. We're not insulin people. We're not big tablet people. So there's more for willingness to definitely to seek out better food. The physical activity may come in later, but I've seen folks who they joined groups and they started walking. People are willing to do something. They're willing to do something, or you see them and they walk in. They're more willing to engage in some sort of physical activity, whether it's the cardio jam or whether it's the 5K. Whenever there's the 5K, whether it's the cancer walk or whatever it is, you do find that more people given the correct information are more willing to engage in physical activities, and it does lead. Really and truly, if the effort is really all that is needed. So if you, I find folks who are, if they're drinking soda, they're willing to cut out the soda. They prefer to cut out the soda than take the tablet. So they're willing to do so. So it's never. I think one of the issues we've struggled with and I myself included as doctors. Is that we were not given adequate nutrition information as students. And so now that we're talking more about nutrition. Before we thought like, patients don't want to diet and exercise. We just said diet and exercise.
Yes.
But the question is, what are the components of the diet? So we have to make it very specific and say we need to eliminate the sugar sweetened beverages. We need to eat more vegetables. We need to drink water rather than juice. We, like yesterday at the clinic, one of the things that one of the posters that folks really enjoyed and everybody came and they took photos of was my Rethink Your Drink poster, the one of the different beverages that shows how much sugar is in the beverage. When people see the amount of sugar in those different beverages, they have to think twice. So they may not eliminate it or remove it completely from their diet, but they have to think, man, every time I drink that soda,
that amount of sugar.
Yes. So incorporating these visual cues into the education, when people see it, really makes them think twice about their choices.
That makes a lot of sense. I wanted to ask you quickly too. There are people who have been diagnosed with diabetes and they're struggling, asking themselves or telling themselves these synthetic medicines, the metformin, the glyburide, these medicines that the doctor is giving me is not curing not doing nothing for that diabetes and curing it. For a matter of fact, to me, that even causing more problems for me. I am going to go to bush. I'm going to take my bush. I'm going to drink my bush, and that is what I'm going to use. When you get these types of arguments with patients, what do you say to patients? Because a lot of people who are listening are in that situation.
So I say, it's okay to take the bush, but please take my medication too. So there's nothing wrong with. A matter of fact, a lot of medications originated from bush. A lot of the good medications that we use originated from plants. So as long as there is no interaction and it's not going to do the patient any harm, you can have the bush, but please take the tablet as well. Yes.
My follow-up question to that is now about following up. So you have a diagnosis, right?
Yes.
And you've decided, like Carlton said, maybe you want to approach it your own way. You want to try alternative remedies,
Mhm.
or you want to try to reverse it through lifestyle change.
Yes.
How do you know what you are doing
Yes.
is impactful or working? How often do you follow up? How
Well,
should you
Well,
know?
this is why this week at Jolly's Pharmacy you can check your blood sugars.
Mhm.
So if you've been doing the bush, if you've been doing the diet and exercise, regardless of what you've been doing, come and check your blood sugar. If the bush that you're taking is working, let me know what the bush is. You know, I want to know what the bush is and how often you're taking it. I want to know what you're doing, because you might have discovered a new treatment
True.
or cure for diabetes that we don't know of yet.
Mhm.
So the one thing we have to do, and a matter of fact, I did so this morning. I say, I go out on the radio and I talk and I tell people, check their blood sugar, check their blood sugar. But I come today and I checked my blood sugar, and I'm going to disclose my results to you. This morning, my blood sugar, this was after breakfast, by the way, my blood sugar was 119. Let me do the conversion for Canadian and British listeners, or 6.6. I did my A1C too. My A1C is 5.3%. Which is not in the
Normal.
diabetes range or pre-diabetes. Thank God for that. And my blood pressure was 118/76.
Blood pressure is
So I'm
good.
happy about that. So this week, you can get your numbers at Jolly's Pharmacy. We did so yesterday with the people of Portsmouth to check their blood sugar and the A1C. Well, no, we didn't do the A1C. But if you do need to go on to do that, you can do that as well. So you can get your numbers and know what your status is.
And I asked specifically, Dr. Jolly, because I do know that sometimes people, they decide they're going to do certain things to remedy certain things or to counteract certain diagnoses, and they don't follow up. So
Yeah.
like they would maybe say, I'm doing all of this, and so I must
Be
be
working.
it must be
Yeah.
working.
That's-
But I wanted to know for sure,
That's all right.
how
So
do you know?
That's okay. And so that's why I encourage folks, regardless of what you're doing, take a break, take the time and check your blood sugar. And that will give you the information as to whether what you're doing is working. And if it is some bush and it is working, let me know. Because there are people who have taken matters into their own hands and they have followed. A matter of fact, there's some patients who don't even follow my medication recommendations. They just do the diet and the lifestyle, and they come back and their numbers look perfect. So it is possible. It does help. Diet and lifestyle changes, they do help. But I encourage everyone to do the monitoring. You can do the monitoring yourself at home, or you can do so at the pharmacy. You can go to your health center. You can reach out to your local nurse who can check the blood sugar for you.
Okay.
Yeah, I because it's interesting that you're saying this, because many people, for example, you have clients who have patients who have been diagnosed with diabetes, and they recognize that they are losing weight drastically. Is there an issue with that on how much weight? So if, for example, you find that you're losing like 7 pounds in 1 month, since you got diagnosed with diabetes, when does it become serious?
Concerning.
Yes,
So
concerning.
we have to determine exactly what the cause of the weight loss is. Is it because of lifestyle changes that you are taking, or is it because of uncontrolled diabetes? Unfortunately, some diabetes, depending on the type, most commonly though, the one of the symptoms of the high blood sugar is weight loss. Actually, the other symptoms we know of is thirst, constantly drinking water, going to the bathroom a lot. Some people have sleep disturbances as well, always feeling hungry. but weight loss is a symptom. So you have to evaluate the cause of the weight loss. Some people lose weight gradually over time because they've gotten the diagnosis, they've made lifestyle changes, and they've lost the weight. Or others are unfortunately have uncontrolled diabetes, and so once again, check the numbers. If the blood sugars you tend to be very high, 300s, 400s higher, you find that they lose weight. And if you're losing weight in spite of taking the medication, then you also have to ask the question: well, is the medication regimen, is it effective?
And so that's important, because many times people see these things and they experience these things, and they just, they might feel like they don't want to talk about it. Their neighbors might be asking, what's happening if you get in again, and then they just stay in a corner. They don't want to come out. I know of someone who came to my office with a similar situation, and she was very, very emotional about it, that she didn't want to leave her house at all because everybody was questioning why she was. Yes.
Well, we just the most important thing is to go see a doctor, get evaluated for the weight loss. Is it the diabetes? Is it something else? Some people have overactive thyroid that can cause weight loss as well. So just getting checked out and find out exactly what the cause of the weight loss is.
We have a caller. Let's take this caller. President, good morning to you, caller. Thanks for calling.
Good morning, Mr. Clark.
Good morning to you, sir. Good morning. Are you still on? Yeah, good morning.
We're not hearing you.
We're not
clearly.
hearing you clearly.
Hello, good morning.
Yes, good morning to you.
Yeah, good morning.
We're still not hearing you clearly, like you're going in and out.
Hello.
Yes. We still have.
Hello?
Yes.
Hello.
Yes, we're hearing you. Can ask a question, please?
Hello, yes. Yes. I want to
You're fluctuating.
Yeah, he might have to call.
You may have
back.
to call back because we're having difficulty hearing your question. So if you can, the numbers are 449-3095, 449-3096, 449-3097, 616-4257, and the overseas number is 305-432-9624. These are the numbers if you do need to ask Dr. Lisa Jolly a question regarding diabetes. And here again, we have a caller. Let's take this caller. Good morning to you, caller. Thanks for calling.
Good morning.
Good morning.
Mr. Council London.
Good morning to you, sir.
Dr. Jolly.
Good morning.
Yes. I just could not help myself but call today on your program because of the level of education that's going on there is so important for people to be aware of, especially when I was privy to that chat. I was privy to that chat that Dr. Jolly's have in our office, and since I was privy to that chat, I actually took a picture of it and put it in my status because I realized that a lot of those, and I don't know if you guys are allowed to talk about some of those drinks that have become the go-to drink when people feel tired, when people feel deflated. A lot of those drinks that are being advertised as the go-to drink, those are the drinks that are high in sugar. And I'm not too sure how much leverage you guys have to talk about those types of drinks. But these are the types of drinks that are very dangerous for people's health. So I just thought I should really talk about it because I realize that the amount of persons that get addicted to those drinks, because even me, Fruta was my go-to drink. I mean, I just felt anytime I fit in, or something to something nice and chill. But then I discovered that even Fruta, is high in sugar, and there are many others that, out there that people see as their go-to drink when they're feeling like they want to, feel a little bit energized. If they feel a little bit deflated, they drink a particular type of drink. It makes them feel better, but there are certainly adverse effects on your health with those drinks.
Thank you, caller. Thank you. And again, spread that chat. I'm sure Dr. Jolly will be very happy that if you share it with your friends. And as they say, all of us have to be or see ourselves as diabetics and develop that lifestyle, and we'll see. What we're going to do, you're going to say something, Trudy? We're going to take a break, and then Dr. Jolly wants to share want us to listen to a short documentary. So we're going to take a break, and then when we come back, we go straight into the documentary. We'll take a time to listen to it, and then afterwards we will resume the typical conversations and regarding the documentary. Let's take a break now.
Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. And that is JP Mega. The one-stop shopping Dominica, nigga. You could be shopping and having fun with your daughter or with your son. We cater to everyone. What a happy place. Oh, JP Mega. The one-stop shopping Dominica, nigga. You could be shopping and having fun. Bring papa and mama along. We cater to everyone. What a happy place. Oh, what a happy place. Purchase 6 or more of any item and you automatically qualify for a discount. Check us out at the Mega Store in Funkole, where there's lots of parking. On Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. And on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
Introducing Jolly's Pharmacy, brand new website, www.jollys.dm. It's your time to jump the line. Shop now at jollys.dm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollys.dm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollys.dm. Jolly's Pharmacy, leading the way in healthcare.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
In Sierra Leone, a health crisis is looming.
They told me at the hospital I have diabetes.
Patients will often die because they don't have access to insulin.
Unlike in wealthy countries, Sierra Leone has a severe lack of drugs used to treat diabetes.
They say if you have it, you're already dead or a living corpse.
Diabetes is a life-threatening disease.
My body was weak. I couldn't do anything.
Sierra Leone lies on the west coast of Africa. It's one of the poorest countries in the world. Hawanatu Bangura, Hawa, is 15. Like many diabetics, she has high blood sugar and sugar in her urine.
At first, I didn't realize I had diabetes. Then I noticed that when I urinated outside, it would attract ants that would eat it. I was getting really sick. They tried traditional medicine, herbs, and so on. There was no improvement. I became too weak to go to school. That was 3 years ago, and I'm still too weak. They did tests and said it was diabetes, but I still didn't understand what it was.
Hawa lives in a village on the outskirts of Medina. The nearest diabetes clinic is about 200 kilometers away, the only one in the region. Unlike many diabetics here, Hawa has a diagnosis. There are likely many here who have diabetes without realizing it. In any case, even a diagnosis is only the first step. Sierra Leone struggles to meet even basic healthcare needs. Diabetes is low on the list of priorities. Without treatment, type 1 diabetes is fatal. Many people, including Hawa's family, often have to choose between paying for transport to a hospital and feeding their family.
When I was diagnosed with diabetes, we didn't have the money to bring me to a hospital, so I couldn't get treatment. My parents didn't know what to do. They decided to move us closer to the town.
The town is near Medina, where an NGO has set up a clinic called Help Medina. NGOs often fill in the gaps where the state can't. The clinic does a blood test to measure Hawa's blood sugar levels.
22, that's high.
Normal is between 4 and 7.
Did they speak to you in the hospital about what you should, or advise you about what you should eat and drink? What did they tell you?
They said I should not eat something that has sugar.
Okay.
Something that has starch.
Okay.
I should not eat it. They said I should eat bulgur, but there is no bulgur here.
Okay. So what have you been eating?
It is only the rice. They see me confidently play.
When I see my friends, I feel ashamed. I look at myself in the mirror and see how my body has changed. Being sick is hard. But on top of that, people think I'm a witch. And I know the financial burden my sickness put on my parents. So I feel bad, discouraged about it.
Good evening. Welcome to Cat Radio Bami, 106 FM, the voice of Tonko Limba. We're here promoting health business, especially with Help Medina UK. I'm Mohammed Dafe. In the studio, I have some guests who have come to help me with a very important topic for us to discuss. That topic is diabetes.
Mohammed Dafe also lives in Medina, in Kambia district. He's a radio host and school teacher who has type 2 diabetes.
We talk about diabetes on the radio, public education. We try to simplify the message to raise awareness. The need for many to do a checkup. People here say a sickness like diabetes is taboo. They say if you have it, you're already dead or a living corpse.
Mohammed says he's seeing more and more cases of diabetes. That's also why he does outreach work in his community to raise awareness about the signs and symptoms.
Another challenge is that people say to me, if I get tested and have diabetes, where will I go to get treatment? This makes them ignore the diagnosis. In Kambia district, there's no clinic that gives any diabetes care.
The help Hawa can get from the local clinic is not enough, despite the cost. The Help Medina team decides to pay for her to travel to a hospital in the nearest big city, Makini.
So you've been listening to this documentary, but I recognize people are calling, so we will take some calls. Good morning to you, caller. Thanks for calling. Thanks for your patience, too.
Good morning. Can you guys just explain what the numbers are, like the acceptable numbers for persons who are diabetic as well as those who are non-diabetic?
Very good. Good question.
You know, when it's a concern or, stuff like that.
Mm-hmm.
Thank you. Good
Thank
question.
you. Good question.
Yes. So Dr. Jolly, I think for you, the normal sugar, blood glucose, or if you're diabetic, what would you expect?
Okay. So, normal blood sugar, fasting blood sugar, that means empty stomach in the morning, should be, as I always say, about 100. So less than 100, about 99. If you have two blood sugars more than 126 fasting in the morning, that's diagnostic of diabetes. If you have a if you take your blood sugar randomly, like I did this morning at any time of the day, and it's more than 200, that is diabetes. If you do the hemoglobin A1C, which I did, mine was 5.3%. That is normal. More than 6.5% is diabetes. I hope that clarifies everything, or most of everything. But if you have any questions, you can check online. The numbers are available there as well. Yes.
And for a pregnant woman, though, what would be like? You're pregnant because we know gestational diabetes too is common in pregnancy.
Yes. So pregnancy actually, particularly early on in the pregnancy, your blood sugars actually go down. So and if you have diabetes and you're pregnant, or you have gestational diabetes, the target's actually even lower. So for pregnancy, we expect that it's to make the diagnosis, the numbers are the same. So if your fasting blood sugar is more than it's supposed to be about 100. If you have a random blood sugar, when they do the test, they do the oral glucose tolerance test. When they do it, is if it's more than, I believe it's 140. So somebody call me if I'm wrong. More than 140, we on alert for gestational diabetes. So yes, the numbers are even tighter if you're pregnant.
We do have someone calling in. Let's take this call. Caller, good morning.
Good morning. Thanks for coming to speak with us. I read a story of, I can't remember the name of the country, but it was the people doing their farming and so. And the people would eat their natural food, hunt for animals. And then some organization said they needed help. So they brought refined flour, sugar. They started giving them help. When they started giving them those help, the people started to get diabetes and other illnesses. So they had to build a hospital for them. So maybe if we just change back to eating our things as close to how the animals eat them, diabetes would go away because our body will be healed. We wouldn't have all those refined and processed food and with so much addition to it. So even though our sugar go up a little higher if we eat plenty mangoes, we don't even need to test it, because when mango, we can get mango, we'll eat spinach and cucumber, anything, kukuli, anything. So it's just a lifestyle change, because those people have to get to hospital when they change their lifestyle. All the best.
Thank you, caller. Thank you.
Yes, that's absolutely right. As the caller mentioned, diabetes is largely a processed food disease. And one of the food rules, there's this book by Michael Pollan, it's called The Food Rules. And rule number 2 is don't eat anything your great grandmother wouldn't recognize as food. And so you want to eat food closest, and I always say this, eat food closest to the way that God made it. So if you want to eat it in its most natural state. And so we have definitely seen an increase in the number of cases of diabetes. And that is largely due to the increased consumption of sugar-sweetened beverages, but also processed foods.
Let's say you're diabetic. What amount of fruit should a diabetic consume? Because someone might say, well, I'm having an apple and I'll have soursop, and I will have, because I'm very conscious about what I eat, and I'm eating only natural stuff. No, and I'm no longer eating all this refined foods and processed foods. I'm eating natural. But you might decide you're eating fruits and vegetables and maybe small portion of meat or fish. What amount, because these fruits also are sweet and it's natural sugar.
Yes.
But what amount should one consume?
So fruit sugar does raise the blood sugar. So because it's natural or because it's a fruit doesn't mean that you get to eat all of it. So you can't eat the whole hand of banana or fig, and you can't eat the whole basin of mangoes. Yeah. So it's okay to eat some, but again, in moderation. I know that's a very vague term for people, because for some people the whole bucket of mangoes is moderation. But you can have one, or you can have a slice of one. But you have to look carefully at the portion sizes, particularly fruits that have a lot of sugar, and those include watermelon, grapes, banana, mangoes, and a bit of pineapple too. So it's okay to have 2 slices of pineapple, but not eat the whole pineapple.
It's interesting, Dr. Jolly, you listed watermelon first on the list. A lot of people feel it's not a sweet fruit.
Yeah.
Because, it's one of those that it doesn't punch, the sweetness doesn't punch you, it's like a watery fruit. So I've heard a lot of people say, watermelon, you can eat that. It's not sweet like, mangoes.
Yeah. But watermelon and grapes have the highest glycemic index. So
it's very interesting.
It raises the blood sugar, because actually it's mostly sugar water. You see? So that's probably what makes your sugar go up very quickly. And the portion of a watermelon is a little triangle, and about 1 inch thickness. So when we eat watermelon, right, we take like a quarter or so,
right,
and we go sit down on the porch,
for sure,
and eat watermelon. But so the portion size is important.
It's one of those fruits, when I researched, I was shocked, because people would say it's not sweet, it's okay, and you eat a whole, as you said, like when it's in season, they sell it, you buy this big piece, and people would think it's fine that you consume a lot of watermelon, because it's water. So that's just a very interesting fact. Read the glycemic index of watermelon and grapes.
And referencing cereals.
Yeah.
Because I remember being, one doctor saying to me, because I like Raisin Bran and Alpen, and he was saying, those cereals, they're laden with sugar, I should not be using them, and that type of thing. So in terms of cereals, because again, when we think of healthy foods, we think of, your fruits, your cereals,
and also your dairy things like yogurt. People would tell you healthy.
Yes. So particularly if you do you can eat those foods, but you have to look at the sugar. So yogurt is not bad, but the flavored yogurt,
the sweetened one,
the flavored yogurt. So whenever companies sweeten either the food for you, whether it's a drink or whether it's a yogurt or it's a cereal, because some cereals are sweetened, they usually add more sugar than if you would have done so yourself. And so if you decide to do cereals, then you want to do either the cereals that don't have any sugar, or any the added sugar, or you do the bran without the sugar. Yes, and you can add your raisins for natural sugar if you want to think of it that way. But the ones with they have
the Cheerios and those.
Yes, those usually have more sugar. The other thing is that we're not as aware of it, but it does have more sugar.
Because the nutrition aspect is quite problematic to many people,
and complex,
and complex. As to what my plate should look like. I get up in the morning and I have to make breakfast. What should be my breakfast? A lot of people don't understand that, and it's oftentimes difficult. So you would have breakfast, you might have sausages, you might have a piece of bread, you might have vegetables, if that, and then you still have, because I read in one literature that indicated that diabetics are supposed to eat 6 times a day, but small portions.
Yeah.
Right? So that's a fact.
I think that is difficult for anybody to eat 6 portions a day. Is very difficult. So one of the things I try to encourage to make it a little easier is to have meals. So you have your breakfast, your lunch, and supper, which would 3. And if you want, you could have a snack, like a small snack in between. So that's 5.
So I think maybe that's what they consider in the meals.
So you have
small portions.
Yeah. So you have. It's important. One of the rules actually is to have meals. Oftentimes we struggle with what is called snacking, particularly if you're doing activities like you're in front of the TV, then you're snacking like the Pac-Man. And when you snack, you tend to eat more than if you just sat down and had a meal. and so having meals is important. It's important not to skip meals, because then when you skip a meal, you tend to compensate for the skip meal the next time
That's
you
true.
eat, or sometimes you end up snacking, and snacking tends to sometimes be less healthy food. So yes.
So as you mentioned in skipping meals, what about the intermittent fasting that is
Yes.
becoming so big now?
Yeah, so I will leave that up to the specialist, the nutritionist. But the nutritionist does mention, even the Charlotte who comes to Bon Santé, she advises against skipping meals.
Mm.
Yeah. So.
I see we have a caller. Yes, let's take this caller. Good morning to you, caller. Thanks for calling. Good morning, caller. Caller, are you there? We may have missed you.
Yeah.
Feel free to call again. The numbers are 449-3095, 449-3096, 449-3097, 616-4257. And again, you are always welcome to call from overseas, 305-432-9624. Let's take this caller. Good morning to you, caller. Thanks for calling.
Good morning, Carlton.
Good morning to you.
Yeah, I wanted to be all ill, but the documentary that you did earlier, and Dr. Lisa mentioned something that really prompted me to call. The situation, the documentary, as you say, tells me one thing, that the whole world is addicted to the two things that cause major problems in our body, which is sugar and flour. And flour is even deadlier than sugar. And you've seen a lot of people going around. And as you even mentioned about what do you eat for breakfast, I mean, in Dominica, I can see bread is what's on everybody's table. Or mostly, I shouldn't say everybody, mostly everybody's table. And we have problems. And then you have now, with the bad diet now, you have the belly fat. And the belly fat, the fat in the belly is another deadly area for the fat because it causes a lot of problems. Because everything has to go down there to get digested, and then you have the belly fat and you have the sugar causing that fat to not dissolve or not burn out, then you have serious problems. So I'm saying, I want to pick up Dr. Jolly again because when you all had the your time of in July when you celebrate, what that was? Appreciation Day.
Yes.
Yes. Yes. She actually had in her aisle where she was showing what your plate is supposed to be like. And I want to dig up because a while ago she just said that you eat your food as best as God provided it. And this is very significant. She said that day and she said it almost half-half, and I wanted to stress on that because that is a serious friend that we have. And I have a serious concern about a pill for every ill. And there are too many ills, too many pills, and then we have food that can conquer all these problems. And if we just eat it in the right proportion as God created it, I think we'll be better off. Enough said for now.
Thank you very much. Thank you.
Oh, I just wanted to go back because I think he mentioned the documentary. So the documentary is available online on YouTube. It's called Diabetes in Sierra Leone. So it's an interesting, and I didn't play it as a way of disparaging this West African country, but I did want to highlight the disparities and the differences that exist in terms of diabetes care. So it's a short documentary. It's about 12 minutes long. It's this young lady, 15 years old, who's actually had type 1 diabetes for 3 years and has not been able to go to school because of the diabetes. She has to travel 2 hours so that she can check her blood sugar at a clinic. And if you watch later on in the documentary, she had to travel an additional 5 hours. And some people, later on in the documentary, they do mention that some people travel as far as 5 hours to that clinic to see a nurse who worked in a diabetes clinic who can provide the necessary care and education to manage the condition. And so it highlights some of the disparities that exist as far as diabetes care. And so one of the things I have tried to highlight this week is that we at Jolly's Pharmacy, they have organized a shelf
Yes.
A shelf that shows all the different supplies for diabetes, including glucometers, food items. I think there's some exercise items and some supplements. And really and truly, here in Dominica, you don't have to travel 2 hours to check your blood sugar. And so, or have access to insulin. And so, I think it's doable. Yeah.
Yeah, I think we're definitely more fortunate in that
True.
regard in terms of access to
Yes.
diabetes care.
Yes,
Mhm.
we have the tools to make the diagnosis.
Mhm.
The food is available,
Mhm.
and we do have if you do need to be treated with medications, or many people now have their own glucometers
At home,
at
yeah.
home, so you don't even have to leave your
To
home to
leave your
check your
home.
blood sugar.
We have a caller. Let's take this call. Caller, good morning.
Good morning, Jacinta.
That's Trudy.
Good morning to you, sir.
Julie. Oh, God. You guys can be on. Anyway, good morning to you and Carlton and Dr. Jolie.
Good morning. Good morning.
Yeah, interesting program. I'm listening and I'm wondering what effect does foods like sweet potato or plantain or even our bronco vision, which has a lot of starch, and they say, when I used to go to school, they used to say starch does turn into sugar, but they are natural, almost like how God make it. What effect would it have on somebody with diabetes, or how can it raise the level of diabetes, or just what's the effect of natural? They are natural, but yet some of them, as you stated just now, still have a lot of sugar. But if the sugar is natural, it's not fermented or processed, I wonder if it will have the same effect as, let's say, like white sugar or white flour, processed food, and so on. Because
simple sugar.
Irving just said that in Dominica, a lot of our breakfast is bread, but up here, like in Jamaica, the breakfast is mostly be like ground provision. And some ground provision has a lot of starch. So, I just want to know the effect. Even if it's natural, and we know it still has a lot of sugar, if it's the same kind of sugar that we buy in the store, processed or refined or so on. Anyway, good program. I'm listening.
Thank you. It is still a simple carbohydrate.
Yeah, but it's some of the ground provisions though are
they complex?
Yes, and
And
so they're a little
get the
better.
fiber
so
from
the-
it as well.
So the nutritionist does say you could have them 3 times a week, 3
Mm.
times a week. So yes, but there are a couple. Yesterday was World Diabetes Day, and we had the clinic at Portsmouth. And we will continue testing. You can check your blood sugar during the week. And I have for some lucky customers, if your blood sugar is really high, you do get a copy of the plate, the healthy plate. I think, Carlton, do you have any? Or do you need-
Leona has. We have in
Leona
the
has.
office.
Oh, yes. So I do want to
Yes.
give a thank you to Leona Jeremiah for organizing World Diabetes Day and Week today, and everything that she has done, to at the pharmacy in terms of organizing the shelves and all the planning that she has done. I think yesterday was a really
Yes.
nice day, and
Yes.
we did it in conjunction with the American Canadian School of Medicine, and the students were there, and I think it was a good turnout. People enjoyed the folks enjoyed the cardio jam too.
It was. It was. Let's take this caller. I see the lines are going. Good morning to you, caller, as we wind up. Good morning to you, caller. Thanks for calling.
Good morning. I have a question.
Sure.
Can you explain or talk about a bit of steroid-induced diabetes?
Steroid-induced diabetes.
Yeah.
Okay. Interesting.
So there's different types of diabetes. The most common, 90%, is type 2 diabetes. But steroids such as prednisone, dexamethasone, which are commonly given for different conditions, do raise the blood sugar. And so if the steroids are taken over a long period of time, And depending on the dose as well, it will raise the blood sugar. So the blood sugar does go up. And so sometimes if you're on steroids for a long time, some folks take it for like rheumatoid arthritis or inflammatory conditions, they do have to be treated with diabetes medications too.
At the same time.
Yes. So that is one of the things. So steroid-induced diabetes is a thing.
Definitely.
Do we have time to take one more call or?
Yeah, we can take one more.
One more call. Caller, your last caller. Good morning.
Yeah, I got on the last caller. I want to make that intervention. The caller before me, I think it was Bob Marley who was mentioning about our ground provision. I think everything has to be done in moderation. And what the advice I would like to give with complex carbohydrate our provision is that rather than having in your plate in one meal, you're dashing your fig, your plantain, your yams, your sweet potatoes at one time, break it down into just you having dashing alone, a few slices of dashing that day, and just dashing, but don't mix them up. Because when you have all that grouping of complex carbohydrates, I think it can cause some kind of problem too with your blood sugar spikes. So that I just want to interject that. Have a good one.
Thank you.
All right.
Thank you very much.
So I just wanted to mention there are a couple good articles on News Online that speak about diabetes. They were published yesterday. And I just wanted to read the first couple paragraphs. But diabetes is a major health concern in the Caribbean region, affecting millions of people and burdening healthcare systems. And that's by the Caribbean Public Health Agency, or CARPA. CARPA. The Caribbean, it has one of the highest prevalence rates of diabetes in the world, with many individuals unknowingly living with the condition. And so that's why we encourage folks this week, regardless of whether you know or you don't know, to check your blood sugar. Factors such as genetics, lifestyle, and limited access to healthcare have contributed to this alarming rise. In 2019, the World Health Organization, according to the World Health Organization, 1.5 million lives were lost to diabetes globally. Alarmingly, several Caribbean countries reported the highest age standardized death rates due to diabetes. The burden of diabetes is not limited to mortality. It also has a significant contributor to morbidity in the regional population. And so they go on to mention the complications of heart attack, stroke, blindness, kidney failure, and lower limb amputation. And so there are a couple interesting articles online to celebrate World Diabetes Day. Once again, we encourage everyone to come out and check their blood sugar. This morning, my blood sugar is 119. That's after meal, so that's normal. Thank God for that.
All right, so it's 11:34. We actually have to say goodbye to you. It was a pleasure, again, bringing this episode of Health Vibes to you, as usual. And hopefully next week, Wednesday, we'll be back with another very interesting topic. From me to you, as always, your health is indeed your greatest resource. Preserve it. Have a good morning, everybody, and continue to take care of yourself. Bye-bye.
Goodbye.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo, with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes.